What can I do about my bumps and under eye wrinkles? My skin is thin and looks awful. For the last 2 years, I tanned all summer in tanning beds and have been out in the sun my whole life. I'm not yet 21, and I'm so terrified about my under eyes. I feel like I look so old, and I'm gonna look terrible by the time I'm 30, even if I wear sunscreen every day and use anti-aging creams. What can I do to reverse the damage permanently and look my age?
Thank you for your question. You submitted your question with a photo, and you state in your question that you're not yet 21 and that you have done a lot of tanning using tanning beds for the past 2 summers, and that you are now very concerned about the aging effects on the skin, the wrinkling and the appearance. And you've expressed a concern that perhaps your trajectory of aging appearance will be considerably worse by the time you're 30, even if you were to use topical creams and sunblock. So of course you want to know about things that you can do to help with this situation. Well, certainly I can share with you how I have advised a lot of my patients who are in similar have been in similar situations, and many have not had the same level of insight as you have had, realizing that in only 2 summers what kind of aging effects tanning beds have had. We have patients who have been using tanning beds for a much longer period of time for a variety of reasons, so I can certainly share with you my perspective. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people with the aesthetics under the eyes has been the focus of my practice for over 20 years, and we live in a very good time where we have a lot of technologies, and particularly the emerging area of regenerative medicine that I think is relevant for you. So I think that it has been something that doctors have struggled with when it comes to helping particularly fair-skinned people, but I'd say all skin types are impacted by the realities of already sun exposure thanks to a depleting ozone layer, as well as the incidental sun exposure for those who live in areas which have much more sun. And then on top of that, this acceleration of the skin aging process, which is actually referred to as photoaging, that occurs with the ultraviolet light of tanning beds. Essentially what happens is the ultraviolet light breaks down the collagen that makes up the skin, and that accelerates the aging process. Now, that being said, there has always been an attraction to the use of different laser devices to help people improve the appearance of photo-aged skin, and particularly that does apply for a lot of patients. We routinely, when we do under eye surgery, we will often combine taking care of under eye bags with fractional erbium or fractional CO2 laser. Certainly for general aging and incidental sun exposure, it's very, very good. I am more cautious when I do treat people who are younger. I feel that a lot of times younger people who seek the help of doctors or non-physicians who offer lasers tend to get overtreated. And what I mean is, when someone is younger and you're dealing with skin that's only a half a millimeter in thickness, it's very, very thin, and you get aggressive laser treatment, you may be contributing to the aging process by over thinning the skin. And that's something that I've made an observation with for many years. I would say that a lot of times what I tell my younger patients is the human body has remarkable capacity to repair, especially when you are younger, and when you have taken away the offending agent that is causing the aging. Now, this can be also said for something like smoking. Patients who are very bad smokers or who have been smoking for a lot of time, once they stop smoking, it is just remarkable how much better their skin can look. So I tell my patients that, of course, a foundation of healthy lifestyle is very important. Eating properly, sleeping enough, exercising, wearing moisturizers, sunblocks, and maybe something in the retinol family or something with some active cosmeceuticals. That can help topically. We can also consider using something like platelet-rich plasma. Now, platelet-rich plasma is derived from your own blood, and it's a concentration of the cells that are necessary for wound healing. The point of doing that is that it actually has been shown, literally in front of us in our practice, that the skin quality improves and the collagen, the blood supply, the quality of the skin improves with some consistent treatment. So I think it's worth considering. I think that you are taking the most important step, which is to stop the tanning. And I think proper skincare will in itself give you some restoration. There are certain laser technologies that could be beneficial in terms of stimulating collagen remodeling, but you have to choose that in the context of whether or not it's going to be worth it and whether it is going to make enough of an impact for you to be able to see. A lot of times people are very impatient. They wanted things to be erased, and of course lasers often are perceived as devices like in science fiction to erase wrinkles, but they're tools, and they're very specific strategies in employing these remarkable tools. So I think look into platelet-rich plasma, talk to a doctor who has experience with patients in your age group, and think about the risks, benefits, and of course the costs of doing these procedures, and take it from there. But again, I think you've already done a good thing by stopping the cause of the acceleration of the aging process. So I hope that was helpful. I wish you the best of luck. Thank you for your question.